devastating for our community. Our Community Input Committee will have some recommendations later on, and I'm hoping nobody gets confused that this is taking anything away from the Diversion Center, because we'll be addressing some plans we once had in the past about 2 centers, east and west, and walk-in access and things like that. So we're not trying to take anything away. This is just next step in a long-term plan. And again, congratulations to that Diversion Center and all they're doing. And also thanks again to the Diversion Board for convening the Public Input or Community Input Committee. Because as we'll mention later on, when we get to that in the report, the county website does state that a goal for the county is that all voices are heard and valued. And it even mentions specific and intentional commitment to reaching underrepresented populations. And that's what, through your guidance and support, our Public Input Committee has been able to do, and we hope to continue doing that. And thank you for that opportunity. Thank you.
Mr. Heller, thank you as well, and the whole Community Inputs team for your time, your commitment, and your passion to this project. And shout out and kudos to the Oriana House staff. Meeting after meeting, quarter after quarter, we consistently hear about improvements and how value you are in community in utilizing what we call a human-centered design, and which sometimes it can get difficult to do in the work we do, especially when it's criminal justice facing. So we appreciate you all so much, as well as you all, for your time, your thought process, and community input, and your recommendations to make this a better Cuyahoga County for all our constituency. Tyler, who is number 3?
Next, we have Dr. Testa. Did you sign the wrong? I thought that might have been the case.
I'm sorry.
No, that's
I was just signing in and I wasn't on the board, so I was like, oh, I
okay.
don't have a comment.
Okay, and then the last one, Rosie?
Yes. So, you probably aren't gonna thank me after this, but, just keeping it real. So I'm a member of the City of Cleveland Mental Health Response Advisory Committee and the Diversion Community Input Committee. These, comments are my views and reflect my opinions alone, okay? Why are we here today? Cuyahoga County never needed jail diversion center. Sorry, I didn't expect this.
Take your time.
It's just frustrating because some of us have been working on this for 7 years. It is always needed a crisis center with a no wrong door approach, with universal access for both law-abiding residents and those accused of committing low-level nonviolent crimes. Despite the spin about the diversion center's so-called success, the current model is not working. The data shows that many people are leaving against medical advice. I want to make it clear that I have nothing but good things to say about Frontline and Oriana House. Thanks to Oriana House, there have been many success stories, but the fact that people are returning suggests the length of stay needs to be extended. In fact, the county's original RFP was for a program with up to a 90-day stay. When St. Vincent Charity Medical Center pulled out of the proposed collaboration, the county reissued an RFP for a program with a 5 to 7 day length of stay. It has never been publicly explained why St. Vincent's changed their mind or why the Budish administration changed the length of stay parameters when they reissued the RFP. It's been almost 2 years. It's been, okay, so I don't know if any seats are going to be open next year, but I would really like the administration to consider that somebody with lived experience with mental illness, substance use disorder, and or involvement in the criminal justice system be considered. I wanted to say that I looked at the duties of the Diversion Board, and it's acting as a resource for information and advice for the Diversion Center, crisis intervention training teams, and crisis response teams. Also encouraging community outreach and public participation. So basically where I was going with that was I've always felt that the Diversion Board should have created a community engagement committee. And So what has happened is, we were blindsided during our meeting last week and told that the Adams Board is no longer going to be convening our committee. And that always blindsided in that we were not sent an email or given any hint beforehand. So I would like to know if it was always planned ahead for the previous year when they were asked to do this, that they would only do this for a year. And I want to praise Scott and Claire, because we would not have accomplished everything that we have without them. But we are going to ask what the county's plan is moving forward to provide us with administrative support, because none of us even have a Zoom account where we can meet for more than 45 minutes. Also, because this proposed committee was created, the Mental Health Response Advisory Committee was told that it would be duplicative to have a diversion subcommittee and this county diversion board community input committee. So all the MRAC members, with the exception of myself, voted to disband that committee to create this committee. And so one of the unintended consequences is that we were not involved in making recommendations about this diversion center contract extension. And also the city is about to spend $5 million in ARPA money to expand their co-responder program. And because we don't have a diversion subcommittee, we didn't even know about that. We weren't discussing it. We weren't making any recommendations. So all those bad things happened, basically, that we couldn't give input, and now all of a sudden the rug has been pulled out from under us. So we still want to continue. We don't want to disband this committee. Thank you very much for your time.
Thank you, Rosie, for your time. And believe it or not, no, we do thank you, even when it's not always what we want to hear, right? So to create equity, you have to ensure that everyone is heard. And everyone has a right to an opinion and an entitlement. And so again, your opinion is valued and we respect it. I think one of the things that you pointed out, which is very important for everyone to hear, is this is a board of very limited authority. And so the way in which you would like us to engage community, I think we welcome your feedback. We've heard it multiple times about the breaking into committees. I think that you are aware that the county itself will be going through some leadership changes in terms of structure. And so the fact that you continuously say it in an open meeting is a good thing, because that allows for us to think, that allows for it to be documented, and we may be able to move forward in that approach in ensuring that, number one, someone who has lived experience can be a part of the board. And if we may be able to make that type of change because you keep openly restating. And number two, maybe we want to look at, as we go into next year, is there an opportunity to kind of break into subcommittees based on what our charges are, and how does that look for us? And we can examine that with our chair, and so it will also be duly noted by way of which what I'm restating and what you just said. I think the third thing that's really important to also reference or mention is that when you think about how the city versus the county spends its money, the efforts are not duplicative. And so while our county executive would like to have some level of a regional approach, our county executive does not control our mayor of the city of Cleveland, how they spend our ARPA resources. And so I would argue the next time they decide to make some recommendations about dismantling you all, now you know from an advocacy standpoint, perhaps that's not the best idea and you want to recharge and reinvigorate yourselves. I would say from this perspective, there was no timeline as far as I am aware, or any other board members, unless you want to speak on our behalf, about how long community input would go. And so to be able to start that back up, I think would require a discussion between our chair and perhaps our Adams Board CEO to see if there's a way or time frame, or be more clear about what the time frame is. We are in the beginning of the meeting, so I think we have a little time just in case there's anything Scott would like to respond to. I think that's fair, or be able to explain or justify. And so I'll acquiesce and give the floor to CEO Oseki.
So you want to do that now? Not
Yeah,
just
sure,
okay.
while we're in public
Yeah.
comment, unless you were going to report on it later, and then we can go back and revisit.
Well, I know that the committee will be giving their report, but
Okay.
I just want to make a comment, right? We admire Rosie's passion as well as Larry's passion, but sometimes it's not communicated in the way that it is intended. No offense, Rosie, right? As far as it being pulled the rug out from under her and blindsided, we talked about it, we told them about it in a meeting. When else would we be able to tell you that, right? Also, that the Adams Board, we really feel that we have met all of our obligations that Dr. Boutros asked us to do, to convene a group It wasn't an official committee at all. It was just a group of folks, right, that were getting together that would be able to provide input to you. It wasn't input from the Adams Board, it was input from that group. And also looking at it, as the Adams Board being the leader of it, may not be in the best position because maybe they're making recommendations to us, right? Because we have the contract with the county, we have the contract with Oriana and Frontline. So it's just a different position. So that's why we have elected to not be the leader or convener of that group.
Thank you, CEO Seki. And so Rosie, after hearing, I hope that gives a little bit of comfort in understanding their position. That doesn't mean that takes away yours.
Correct.
So what it means for us as a board is how do we thoughtfully think about how do we continuously move forward with your input? And again, you gave some recommendations, and I think that's for us to think about whether or not we're going to break into committees, whether we include you in a committee, or whether you continuously move forward as an advisory board to a particular committee. And so that'll be well noted and documented. Don't stop saying it. I would also encourage you maybe to informally meet and document your recommendations, and then we can think through what does that mean for us moving forward to have that information.
Thank you, Ms. Bryant. I appreciate it.
I appreciate you as well. If there are no other public comments, we can move forward with agenda item number 4, which is a voting item, approval of our minutes from August 11th. So you guys take a couple minutes, maybe the next 1 or 2 minutes to review the meeting minutes that you have before you, and then I will welcome a motion to approve or any edits or amendments to them.
Make a motion to accept the minutes as presented.
Second. All right, hearing none against, we have a motion to approve by Mr. Mason and a second by our doctor here. All right, all in favor, aye?
Aye.
Those opposed? All right, we will move forward with accepting those meeting minutes and moving to number 5, which is a metrics overview and discussion from the Adams Board staff.
That's me.
Yeah, just give me 1 second to pull
All right,
Or Melody, yeah.
solstice.
I think there's a PowerPoint that goes along with it.
yeah, Tyler's pulling it up.
Yep, pulling it up.
And just for our record, Chief Drummond has walked in for. I had to put you on the spot.
Won't be the first or last.
Ready to go, Claire?
I'm ready to go.
All right, Claire's already ready to go. Everybody has the PowerPoint. It's a hard copy over there on the table if you do not have one. And Claire, I'll turn it over to you now.
Thank you. My name is Claire Rosser. I'm Chief of Strategic Initiatives with the Adams Board of Cuyahoga County. This overview will be much more brief than the last overview. These are just kind of the updates and basics of the information you've got in front of you from the metrics report. We went over a few additional pieces last time, but trimming it again back down this time. This goes over the quarters 1, 2, and 3 for this year so far, and has information up to September 30th of this year. Next, please. All right, so again, just down to the basics here, we're going to talk about Frontline Services, our call center. We'll talk about Oriana House operations, and then we'll talk about the Adams Board CIT training. All right, so first, our Frontline Service call center is 24/7, 365 days a year, call in line for law enforcement and others to screen for the diversion center. So for quarter 3, Frontline received 133 calls in July, 119 in August, and 114 in September. So that's a total of 366 calls for quarter 3 of this year. If you add that together, so that follows the trend of calls increasing each quarter, and it's actually a 38% increase in call volume compared to the first quarter of the year. Things are moving in the right direction. And the percentages of where those calls come from are staying about the same, with 32% from police and 68% from all other categories. Okay, next slide, please. Oriana House operations. So this is the second area. Oriana House operates the 50-bed diversion center. In 2021, 149 total clients were served after its start date of May. So far in 2022, 456 individuals were served, so that's a total of 605 admissions were completed. As this group knows, I always focus on the admissions numbers. Those are the folks who arrived at the diversion center, made it through the admissions process, and engaged in services. So there were, on this, I've also included the number of contacts. This is something that's always included in your report as well. Contacts, we've had 1,169. Contacts are instances when a potential client arrived at the diversion center, and from those 1,169 contacts, the admissions process was completed for 605 times. So when an individual is eligible for admission, it's still the individual's choice to stay at the diversion center. Next, please. All right, so length of stay.
I'm sorry, Claire, can you just one more time repeat how you use the word contacts for that? What exactly does that stand for? I apologize.
Yeah, so this is always broken down in the metrics report. It's always listed intakes versus contacts. So intakes are someone who arrived at the diversion center either through police transport or their own means, and then went through the complete admissions process, engaged in services. So that's a full and complete engagement. And then contacts, again, you know, we have individuals who interact with the diversion center and then come back and interact again and then come back. You know, sometimes there's, that's kind of the nature of some of these illnesses. Contacts are individuals who have arrived at the diversion center and at some point in that process opted out. So that's the full, you can almost describe it like these are the number of individuals that, and it could be repeat clients, who made it through the door, but maybe didn't fully commit the whole way, right? So that's kind of the difference between the two. All right, next slide, please. So this is length of stay. The average of all clients, we break it down by serious mental illness, and substance use disorder, a dual diagnosis, or just substance use disorder, diagnoses of the clients. So if you take the average of all, it's 4.57 days. It varies based on client need, and the types of services that are administered are the same. That hasn't changed. Next slide. So connections to aftercare, the number of clients who were connected to a community agency or service. So of that 605 intakes admissions that I described, 362 received connections to a community agency or service after their stabilization period at Oriana House for the Diversion Center. And then the number who either refused or did not receive connections, that's 243, and that includes the 209 who left against medical advice. There's a list of close to 80 community agencies and services that have been working with the Diversion Center for aftercare, depending on the client's needs. And next. All right, so the Adams Board provides CIT, that's Crisis Intervention Team Training, for law enforcement. I'll give the usual reminders with this chart. This excludes the city of Cleveland just because we have another contract that we work with them for training Cleveland officers in relation to the consent decree. And then this also includes, the numbers are always going to be just a little bit different from what you see in your metrics report, only because of time frame. In 2021, we started training those officers before the metrics report started collecting information. So I think when you add it up in your metrics report, it's 885 total officers. But if you include the ones that were done before the metrics reporting started, then it's 982 total. So You can see that there are 3 types of training: the full 40-hour training that certifies an officer as a CIT officer. We have special trainings for dispatch, for emergency dispatch staff, and a refresher for those who have been certified but are going through and updating their skills. So again, we've been providing the 2 40-hour CIT trainings per month, along with 1 8-hour dispatch and 1 8-hour refresher. And that includes all of 2021 and the quarters so far in this year.
Can I ask a quick question? I know this has came up before, but I know the trainings that you guys do through our contract, one of the modules is on the Diversion Center, which is great because you have the audience. Is that also the case for the City of Cleveland Police when you guys do theirs?
Yeah, we've been doing education on the Diversion Center for, every law,
Yeah. I thought
every
so. I
time
just
we're in
wanted to
front of a
make
law
sure 'cause I know
enforcement
it came
group,
up
but yeah.
before. Thank you.
Indeed. Okay, and so the next slide. So any questions or comments that you have? So the next time I'm in front of you, it'll be for a year, looking at the full year at a glance. So if there are any that you want, any pieces of information that you'd like to see that kind of compared over the year. I know we were going to look at length of stay quarterly. So that's something that I'm working on putting together. It changes very minutely month by month. So putting together that quarterly view of the whole year might be a little bit more valuable to us, and then we can start looking at it quarterly going forward. So I know that's a piece of information that you are all interested in seeing, but do let me know if there's anything when we're taking another full year comparison.
I know last, and I wasn't at the last meeting, and you guys did touch on this a lot, I heard, but some of the people that have consistently come to the center or come back versus kind of the new people, I'd be interested to kind of see,
Okay.
That dynamic and what it looks like.
Yeah, we
I
took
try
a
and
look at
follow
that
it through the
for,
monthly metrics, but it's sometimes challenging, understandably, so
Yeah.
that'd be good.
okay. Hi.
Yeah, first of all, thank you for providing the data, and just want to emphasize the positive that calls are definitely going up, and use of the diversion centers going up and going in the right direction, which is sometimes hard to get when you see the weekly data coming in to know that it's actually moving in the right direction. But I'm also interested in, the follow-up. It sounds like about, a good amount of people are getting referrals. Do we know, or can we find out who actually follows through on those? Is that possible?
Yeah, I mean, that's something that we've been looking at how to track. I don't know if I have do we have any updated information beyond what we've shared in the past here?
No.
No.
I think, because of the billing cycles. The only way we would be able to track are the billing cycles of the people who went through the diversion center, if they're getting services through the Adams Board, right? But if they're on Medicaid, we don't get that information.
I see.
And then there's the HIPAA violations or whatever
Yeah.
because we originally started, we were making calls to each one of the agencies, and they didn't want to give that information because of the HIPAA violations. So it's hard to get an exact count on that.
Okay,
Yeah.
thank you.
Yeah, we can see kind of one
We
portion of
did
it.
ask
that had been-
Adams to do that for the contract at the beginning. I had asked to follow up for those metrics, and understandably, it was challenging to find a way.
Thank you.
But Oriana, excuse me, Madam Chair, but right, Oriana knows when you're making the referral.
We take
Right.
they enter the program.
Yes. They know
refer
they
to.
enter.
We know who enters the program and they go there. What we don't know is what happens after they enter the program. Do they stay a week? Do they stay the entire, we don't know that. We know we take them there. They go into when they get a referral and go to a place, they arrive at that place and go in, and then after that, we don't know.
They don't apply to me.
Donna, that was a good question. It makes me think about Rosie's, one of Rosie's responses. So the question kind of really, without data though, it's kind of hard to like redirect it to the county about any potential promise of expanding the length of stay. Recognizing it's made to be a crisis center, not a treatment center. And so just thinking about the in-between, since we're now like losing a level of cure in a sense. Is there any discussion about maybe extending the length of stay, which is hard to tell if we need it because we can't see where they ended up at based off HIPAA data and the fact that we don't have a way to track that if it's non-Medicaid, if it's Medicaid funding. So any discussion or just not at the moment?
Discussion takes place here. There's no
Okay.
separate county organization meeting. This is
Okay.
where it takes place.
Okay,
You know, when we started off, as we said, we had looked at other areas that were doing 90 to 120 days. And we looked at, or we shortened the stay. It is when St. B's had initially put in with it, but we realized that there was an immediate need and then there was some resources in the community, you know, particularly on the SUD side. There's a lot of inpatient resources in the community to send individuals. And some of those people we heard back from understandably, and it was duplicative for, hey, we have beds that are available. And that's exactly who Oriana House works with to send people. You know, there's obviously a housing crisis on the mental health side. There's not enough housing. So that residential need, that is a need that we hear all the time in the county. But, you know, we had to, you know, start somewhere and decide what was the
Yeah.
best right now for the diversion center and for that need.
and I only thought about that after thinking about collectively what you're all saying and how we can support as we move into a new year. And now we have baselines and the ability to have comparative data. So that's the only reason why I brought that up. Any other comments or questions for Claire before we move forward?
I just have one more only because it came up today. Do you guys have any way to know the officers, whether it's the same officers coming back and bringing people? Or, like, I don't know if you guys, if there's a way, but I got asked that, the law director happened to ask that from the Cleveland, and I just wasn't sure.
I think we
I
can.
knew the one, but that's it.
I think we can because we have CAD numbers. We track everything.
From you guys, but I just,
Yeah,
yeah.
I know from them, but we probably could. I'm not
Okay.
sure if them, but we
Yeah,
could.
Madam Chair, so Frontline asked for the badge numbers of everyone, so we should be able to get that.
Thank you,
We can have like
thank you.
officer ambassadors to help with engagement and
Just
marketing.
need to know if it's the same people, like I know the
Yeah.
one is, or if the other works, you know, once they see that it works, they keep coming back, which is
Yeah.
great, you know?
Yeah.
There are some like that.
Uh-huh.
The RTA has a couple of officers that frequently bring people, so.
I know Cleveland has too.
Yeah, I would be more inclined to believe that as well. You know, they seem to be the same officers and
Yeah.
understand the diversion center and really
There's-
appreciate it, so they take advantage of it.
There's two of yours that I'm familiar with that have gone a couple times.
Yeah, see, don't knock the officer ambassador right off. It can work. All right, hearing no other questions or comments for Claire, I think we can move on. Thank you, Claire. And the Adams Board staff. All right, our next item is old or new items for discussion. So we'll also start with the Community Input Committee report.
My colleague Larry Heller is gonna give that report.
Thank you, Rosie.
Larry, are you also gonna mention the, survey?
Yeah.
Thank you.
So, thank you. As this board knows, we've done some surveys, Claire, did all the work to get the online version going. And there's a written report that I hope you guys have gotten. That's the written report for the online survey, but in fulfilling our mission to reach underrepresented populations, we specifically used printed surveys and went and did verbal and written surveys targeting certain populations, including the men's homeless shelter and at Community Assessment and Treatment Services, CATS. We did two different populations there, as well as at the shelter. And I would have liked to do more, but wasn't enough time. So we made some recommendations, which came not only from our committee, but also from our surveys. At our meetings, you know, the public is permitted at all meetings and can actively contribute. Only voting members vote, but anyone can bring up issues and make recommendations. So our following recommendations to this board, the Community Input Committee of the Cuyahoga County Diversion Board recommends that the board provide written response publicly to each recommendation from this committee, including any decision regarding the recommendation, any action taken, and any outcomes. The committee recommends that the board notify the public, either on the website or whatever means, and any committees, of any major changes involving the Diversion Center or related contracts. This committee recommends that the board add seats on this board for individuals with lived experience, including mental health, substance use, homelessness, criminal justice involvement, etc. The committee recommends Number 4, the committee recommends that the board propose and support the establishment of a crisis center on the west side of Cleveland. The crisis center shall have unrestricted walk-in access with no one turned away. This recommendation is in keeping with the original planning stages plans for 2 centers, east and west. And again, we'd like to thank Donna for many years of hard work promoting that dream and for making a dream turn into reality together. Fantastic center we do that. This recommendation is in keeping with the original plans for 2 centers, east and west, which will later change to focus on 1 center and expedite the establishment of our diversion center. We, the committee, enthusiastically support and applaud the current diversion center and have publicly stated such support many times. This recommendation is in no way intended to indicate otherwise. We simply seek to help to fulfill our original mission, including both east and west side coverage and including walk-in access. And number 5, regarding our committee, the committee respectfully requests that the diversion board will continue to seek community input through this committee, and we therefore respectfully request that the diversion board provide another convener for this committee. And I understand there may be a volunteer coming soon. But our county website on the boards and commissions page has wording to say that the county intent includes that all voices shall be heard. It states, quote, a major goal of Cuyahoga County is to ensure all voices are valued, respected, and heard, end quote. There's also further wording to specifically mention intentionally reaching out to underrepresented populations. We applaud the diversion board for striving to reach this goal, including by creating this committee. A fundamental principle of this committee is that simply being open to the public does not constitute community engagement or community participation or inclusion. A primary goal of this committee is to intentionally seek out and invite members of historically underrepresented populations. We seek input from our residents, as well as inviting all to join us to engage in deeper participation in our committee or any work groups. We believe this to be an ongoing need rather than a one-time event. We therefore hope and respectfully request that the diversion board will continue to seek community input through this committee, and we therefore respectfully request that the diversion board provide another convener for this committee. This may include, but not limited to, administrative support and providing either meeting venues or platforms. Thank you.
Thank you, Mr. Heller. Okay, so we appreciate the report from the Community Input Committee. And now that you all have live data, full recommendations, that is something for us to be able to look at as a board and take your recommendations into consideration, again, as we move forward for calendar year 2023. I will make sure that the chair and I have some conversation about how do we convene, how to best leverage those recommendations, and we can go back and forth and hopefully have the support of the wonderful county staff here. Brittany and her team has been amazing to help with that, and then have some level of discussion for you by the beginning of the year about what may be feasible, what may be within the power of the actual board, because some recommendations we don't control. And for the things that we can do, make sure that they're well heard. You all have put a year's worth of work into this. And again, we're very grateful. And, you know, when something's new in your building, evolution is necessary. And so with that being said, was there anything that the Adams board wanted to provide in terms of input towards the report or the work that you all have collectively done? I know Claire mentioned she put in some work for the survey, or anything else.
I'll just say that they've done a tremendous amount of work over this year and have met 8 times to put together recommendations and gather community input for everyone. So, and all volunteer.
Sure.
Hi, just wanted to say that it'd be helpful, I didn't see anything written, so it'd be helpful to get that just to all the board members, yeah.
That was gonna be the final thing I actually said, that Larry, we actually don't have it yet. So that will help us as we individually look through the report and what the recommendations are and figure out how we can work side by side to move forward with some of the recommendations you have for a very new board.
I have a question.
Sure.
So did the committee think or consider the number of people who are currently using the facility, the current facility, when you recommended to have another one? Did you kind of weigh that against each other at all?
I'm not sure I understand the question. Are you saying because it's not full, we don't need another one? Is that what you're saying?
Essentially.
Okay. So, I see other people want to talk, but just to answer that real quickly, we understand it's not being fully utilized, but we understand also it does take time for something new to build up to where it needs to be. And we knew that going in, that it would take time for the police to start using it. We obviously know only a few police are bringing people right now. And as that number expands, that center probably will fill up. But, you know, some people like on the west side may not have access. People from like the west side or west suburbs, officers may or may not be willing to go out to the east side. But also for walk-in access, people on the west side may be more likely to show up on the west side than on the east side.
Yeah, but.
And that was the original plan.
And the only thing I'm thinking about, I mean, there's only so much resources, right? I mean, it's about, how much are we paying in a year for the operating?
It's, we're paying about $300,000 or $400,000 a month.
Yeah, so I'm just making the point that there's only one pot of money, and we're trying to do a good job with the facility we have, but to start to talk about having another one on the west side, I just question that.
Just to cite an Adams Board needs assessment, there are more than 20,000 people out there at any given time who need services that are not accessing services right now. And, you know, that's a really untapped segment of our community. And a lot of them, there are numerous barriers to access. A lot of people don't know yet that they can access the center. We're trying to get the word out, but it takes time for the word to spread, not only through law enforcement for them to use it, but also it takes time to spread throughout the community. I am firmly convinced that because I have boots on the ground and I talk to people out there, I think a lot of people who need treatment will eventually access it. And I think we will fill both centers very quickly once they build up to that.
Thank you, Mr. Heller. We want to allow your colleagues to also have time to speak. Rosie?
Thank you. So Mr. Mason, one of the concerns is I watched the county council meetings and the Justice Center Steering Committee meetings, and I see the county council members' comments, and their priority continues to be jail diversion. And I understand that, but the reality is the majority of people using the center right now are people who have not been accused of committing a crime. And what Mr. Heller is referring to, wait, hang on a second. One of my concerns is St. Vincent's is gonna close on November 15th. I'm worried that Oriana House, the diversion center, is gonna get overwhelmed. I've talked to police chiefs in 2 different cities. They don't understand the difference in level of care between a psychiatric emergency room and a diversion center. They think they're interchangeable. I'm not kidding. Despite all the education that the Adams Board and Oriana House has done, like outreach and everything. So that's one of my concerns. And number 2, historically, I believe, and Mr. Heller can correct me if I'm wrong, but what I believe he was referring to was in early 2015, after the Justice Department released their civil rights investigation regarding the Cleveland Division of Police in 2014, December, they asked the Adams Board to convene a mental health task force. The DOJ and Mayor Frank Jackson asked them to do that. I was not part of it, but of the recommendations that came out of that task force, one of them was that a drop-off centers, one on the east side, one on the west side, be developed. Okay, so the Mental Health Response Advisory Committee started maybe 6 months, 9 months after that, and we were always talking about the need for a open access crisis center. So we were given updates by the Adams Board. The Adams Board was working with the county. They were working, I think, with Greater Cleveland congregations, and we would just get updates that there were behind-the-scenes conversations going on. It wasn't until people started dying at the jail, okay, in 2018, that we heard about a diversion center. So that's kind of what we're referring to, is there are a lot of people, Cleveland police, more than 90% of the people in the county in crisis are being taken to emergency rooms, and they're getting released because they don't need that high level of care. They don't need to be admitted. They're not a danger to themselves or others. So there needs to be something in between, like urgent care. So our concern is that, personally, I just want the beds full. I'm not concerned. I want people to get help, whether they're getting diverted from jail or the ER. I just want to, you know what I mean? I just want people to get help. And I know everybody else here feels the same way. But I'm just worried that people who have been able to use this as a resource are not going to be able to use it again in the future. And I know some of us were hoping that this would be so successful that the current location might be a 50-bed jail diversion center, and that in the future there might be a permanent crisis center down the road. So we were hoping that that was what was going to happen.
Thank you, Rosie.
I don't know if that made any sense, but.
Lou?
Let's not think about this from administrative point of view by itself. This particular committee, we conducted a survey. It doesn't matter it was on the paper or the people we talked in person. Larry did a lot of that. The common problem is people do not have a good access to them. Some of the barriers we would name will be, for example, transportation. In this case, if we want to go back to see the administrative point of view, unless you are already arrested by a police, you will have a transportation to go to diversion center. However, if it's from a family or yourself, or you were only taken to the emergency room, but they say you are not really qualified. In this case, lots of people do not have transportation needs in maybe the middle of the night, weekends, to go to get the help they actually need. Another thing to say, sorry, Cuyahoga County could be really segregated. So the public transportation is not very helpful. So all these things added up together, you may not see the number saying the beds are full, but people in need actually is way more than that. This is the reason why at the very beginning, myself object the idea that we only have 50 beds. Even for the people in the women's shelter, 2227 Payne Avenue, do you know the quantity of the calls for police to come in, and they know these people cannot be probated. They are not qualified to be probated, but they do need help in the middle of the night, maybe weekend or whatever. Regular doctor office not open. They cannot talk to their psychiatrist. Diversion center will be a very big help. However, no way for them to have access to it. So some of the factors, if you want to look up in our survey, then you will understand, actually it's not contradict administrative point of view. Actually, we are recommending all the things you can see, the obstacles the communities have been facing. You will be the one having the voice to get them out of the way. So the community will be safer, not overuse the emergency room resources and even the police. So the police can actually go to do more important things. Instead of attending maybe medical or mental issues they are not specialized for. Thank you.
We appreciate the community input committee. So we appreciate the comments from Larry, Rosie, and Lou. And I think that the board here is to serve as the intermediary between the government as well as our community, and how do we all collectively work together. I think that there's enough sense and intelligence around a table to understand the challenges for the county. I absolutely hear Mr. Mason. You have to understand that there are very limited financial resources, and how we spend them as a county is contingent upon utilization for sure, but that doesn't mean that you can't divert other efforts based off of your report, feedback, and recommendations to some of the needs that we see or gaps that don't cost as much, right? So transportation could be something that you readjust in your budget, et cetera. But again, it takes time. It takes takes time to build anything new, and that's why we appreciate you all's feedback and your all time, and then this board as a whole can kind of balance those two things out and figure out where there can be some support moving forward, changes and modifications. And Lou, before we conclude, I want to allow you to add whatever else you'd like to offer.
This is the reason why we would like to follow the original proposal to have 2 locations. That actually decrease the stress when people find out I cannot go because I have no way to get to the other side of the town. And this also is the reason why we highly recommend to have the people either having that experience themselves or the family member who has the caretaker, that kind of experience, to join the board. In that case, everything this board would do, the county government will have to accept because it's not only from one point of view, it's the combination of a different expertise, and they have to take it.
We appreciate your feedback again, just recognizing there's a balance between what everyone would like to see from various sectors of the county and from our leadership. And there's a budget for everything. And so you're able to adjust some things, you get some wins. You won't always be happy, but you have to celebrate the wins that you do have, and you just keep working. And so we appreciate the advocacy. We have a little time, so Mr. Heller, I'll allow you to make a final comment, and then we'll move forward with the court update.
Real quick. So, numerous times people have proposed things and here there's no money, there's no financing to do it. But when we really need something badly enough, there's always a way to find a way to do it. An example, the county recently began planning for a new jail project long before there was any plan proposed for funding it, because people thought it was needed. That's just one isolated example, but anything we want to do, if it's needed badly enough, we will find a way. We can all work together. We can get the community involved. We'll find a way. But first, let's determine what we really need, and if it's something we really need, we will find a way. Thank you.
So I appreciate that comment, Mr. Heller, which is why we spoke about the justification of the need and actually having your report in front of us and figuring out where you can have some short-term and long-term goals. So they have to see the report first before they can make those kind of conclusions. And I want to make sure I allow my colleague time to speak. Donna, did I see your hand?
Thank you. I'm not sure where this fits in, new or old business, but I think there are a lot of questions in the community about the continuation of the contract and where things are with that. And I know that the process is not completed, but it might be helpful for that to be stated in this meeting, like where things are.
I'd be happy to. Thanks, Donna. I went in front of Public Safety Committee this week and was approved for the contract in our Public Safety Committee for a 1-year extension with current, as it stands now, so with Adams Board doing the CIT training and with the Oriana House with their services, we did a 1-year extension. It does have to go to our full council for approval. But largely the discussion happens within the safety committee or one of the committees, and it was passed out of that committee unanimously this week.
Yesterday.
And we do also, if you remember, we put aside funding for a number of years for this particular, to continue with the contract or for a diversion center also, so.
Thank you, Brandy and Mr. Mason and Donna for the question. Are there any other final comments before we move to the other order of business in regards to specialty courts? Go ahead, CEO.
Madam Chair, so just want to say regarding crisis centers, right? So I've been on a state committee looking at development of crisis centers throughout the entire state, and that's what the Ohio Department of Mental Health and Addiction Services. They are coming out with a report based on all of the work that all of the people have done on that. So we're waiting for that. Then also the Adams Board, because when St. Vincent's was having their issues, we have a contract with a consultant, Dr. Catherine Burns, who is actually internationally known. Actually, she used to be here in Cuyahoga County at the Adams Board, and she used to work at Franklin County Board, and she has a lot of experience, and she is looking at our crisis services. So in 2023, probably in the second quarter of 2023, we'll be bringing all parties together, and the community community together once we have actual numbers, right? So we want to look at St. Vincent's, what impact does that have if they're not a psychiatric emergency department, if they don't have inpatient beds, right? They're psychiatric emergency services. With Metro Health, right, we're recommending that we fund some of their psychiatric emergency room at their new hospital in Cleveland Heights, right? So we have to see how the numbers play out with all of these things, right, before we could make recommendations about a crisis center. But the Adams Board is, looking at a crisis center. And a crisis center is a little bit different than diversion center, with the state. I mean, we've turned it more into a diversion crisis center, right? That people are diverting from further crisis or hospitalization and things like that, which is a great thing. But that's why, so we have a consultant working with us. We're gonna look at the data, at least we have from the first quarter of 2023.
Thank you, CEO Osaki. I know it's a difficult job to kind of balance the immediate needs of the community versus data and budgets. So we appreciate that information because it helps us as we move forward in making other recommendations. All right, there was a question the last time in regards to the court providing any updates around specialty dockets. Is there any representation from Common Pleas Court today?
No, they said they weren't gonna be here.
All right, so I'll just go ahead and read what they sent directly from the email, unless Brandy wants to do that.
No.
All right, so and it was an email to Dr. Boutros because our chair had requested that someone come in from the court and provide recommendations. And so because of that, they reached out and said this is their response. They are still seeing positive results from the specialty court diversion policy. They have sent 10 individuals to the diversion center, mostly from drug court and a few from MHDD for detox or stabilization. All are active in SUD and or MH treatment following their diversion stay. They have yet to utilize the shared transport unit as staff has identified other ways to have the clients sent to the diversion center, either by self, family, or transport or case manager. And they continue to remind staff of the referral service as an alternate to the jail. Last month, the court helped host a diversion center training where Brandy, Robin, and Rick presented for criminal justice stakeholders. They wanted to pass that along this afternoon, and they are happy to put together a more formal presentation in the future should the board decide that that's something they would be interested in. Any other input or comments before we adjourn?
I'll go ahead, Tanya.
It's great to hear that update. I wondered if there are thoughts around connecting with the Cleveland Municipal Court in the same kind of way as a point of diversion.
I included them. They weren't able to attend. We had a training and it was good representation. Cleveland Prosecutor's Office sent their entire staff. It was a requirement for it. County Prosecutor's Office sent people. The court sent some people. It was good representation, but we didn't get Cleveland Municipal Courts was the only one that unfortunately weren't able to attend. Come to the training, learn about the training. It was a training just specific to the diversion center and use it. It was kind of because central booking opening up soon, and so we wanted to make sure those people understood diversion in the process. And so the other people did engage the process, but Cleveland Municipal Court was not part of it.
Thank you.
But yes, we want them to participate also.
I think that's a great idea, that the level of criminal involvement fits well for them.
I agree. All right, the final,
I have, if
Oh,
you don't mind, Madam Chair, I'm
No.
sorry, just, I think there's some good news that I was gonna leave if Mike could share. He's very
Oh.
excited
Appreciate it.
to provide this to Bill
One of the
and others.
things at the diversion center that, in our client satisfaction surveys, that the clients gave us low marks for was the food. And that's something we've been working on. Just this past week, we had an opportunity to meet with Brandon from Edwin's Restaurant in Shaker Square. Brandon is known for giving people second chances, helping the reentry population, but he's got an excellent restaurant. He's very interested in providing the food at the diversion center. And the staff will tell you at the diversion center, the food is very important in terms of getting clients to stay and be amenable to treatment. So hopefully everything will go well, and by the next time this group meets, we'll be able to tell you that Edwin's is the food service provider at the diversion.
thank you.
Thank you.
that's really good news because I do remember the conversation about the dissatisfaction. I would also just make another open recommendation in the event the budget may be overly what you were able to provide. Lutheran Metropolitan Ministries, an investment the county has made for years through the Office of Reentry, also has a very similar service. So it won't be gourmet, but you certainly will be working with returnees who are actually working with incarcerated persons at this moment that also has some external catering businesses as well. So I would love to offer that as a secondary option should Edwin's not meet your bill.
Absolutely.
So the last thing we have before we're able to close out, no one else has anything else new or old, is just making sure that we have the proper meeting schedule for next year. And so Tyler asked and strongly suggested, I'm just kidding, that we look at rather putting a couple options up openly on the floor before we leave today. And so either we can, if everyone is okay, we can continue with this current schedule. We can look at a different day of the week that may work best for us as a board, or we can look at a different time option. And so just putting that out there, if everyone is okay, recognizing we're missing a few folk, just continuously meeting at next year at the same time and date, we can move forward, or if you have other suggestions, please feel free to open up and state them now.
Can I ask if people, I think it works, or it has, at least for me, and we've had good attendance that day and later in the day for Thursdays. I didn't know if maybe an hour earlier if that would still work for people, or if later in the day is better. For some of the people that are particularly busy, I'm looking at a few, I don't know if there's better.
My schedule's all over the place. Try to adjust accordingly.
You're losing weight by the moment, by the way.
Yeah.
I mean, maybe it's not an issue. I bring it up because when we first started, people were asking me, oh, that's pretty late in the day, but I haven't heard it recently, so maybe it's not an issue. It doesn't make a difference to me, to be honest.
I would defer to people like the chief who have a far busier schedule than me.
I control my own
This
schedule.
time works great for me.
It's working, I guess, why?
It's a little bit better, 3:30, 4 o'clock's a little bit better for me as well.
Okay.
Yeah.
Then
So we'll just say that unless hearing from the other folk who are absent today, we can move forward and maintain the existing schedule for calendar year 23.
Okay, yeah, first Thursday of the quarterly.
What day would that be
It
then?
would be,
for next meeting?
the next one would be, February, May, August, and November, so the next one would be, February 2nd. We're looking at February 2nd, May 4th, August 3rd, and November 2nd. So I'll shoot an email out to the other board members as well, just, and then we'll get those dates posted on the website as we always do.
All right, thank you, Tyler.
Can I add something?
Sure, Chief.
Not related to this, but just basically, we were approved recently through city council and finance and so forth to expand our co-responders unit. Currently, we have 3 co-responders. We're supposed to have 1 per district, 5. Co-responders are specialized CIT officers partnered up with certified clinician. So the city council just approved it through ARPA dollars to expand that to 10 more. So we're in the process now that, again, it was just approved to hopefully we can hire some more folks. We have officers already in place. And for me, that's really, really important because if we can expand our capacity, I think we're able to help more people with the emphasis in diverting more people rather than taking them to jail. Also, part of that approval through the council was to have a look at care response, which doesn't necessarily include officers. Again, so we can divert people away from jail and so forth. So it's a big push, big emphasis on that. So I'm really excited about that. I think, again, if we grow our capacity and get people more help, and that way we don't even take them to jail, because it's the last thing, again, that I want to do. I think it's important to provide the best services for people who are in crisis, and jail, in my humble opinion, is not it. It's places like the Diversion Center, and hopefully send them to places where they can get the help, the wraparound services that they desperately need. Part of that, too, is our triaging of calls that are coming into our 911 center and our dispatch center. Part of this, the program that we hopefully will have in place is to have mental health dispatchers, which means we'll have the vast majority of our dispatchers trained to triage calls if they're coming, as they're coming in. So rather than potentially having officers respond, they can get it to the right individuals that may not necessarily need a police officer responding there. Our officers are trained, but not to the capacity of someone that's licensed. And so that's what we're trying to do. Again, we're just trying to expand our capacity to provide people with the best possible treatment versus going to jail. And I hope through that, what will happen is that our transport to the Diversion Center will go up. So I just wanted to put that on.
No, that's wonderful news. That should certainly help increase the 32%
Yes.
referral fee.
No, absolutely. That's what
Yeah.
we're hoping, that, again, once we expand it. And part of the beauty, I think, for our co-responders program, again, we're going to be looking at care response too, is that the CIT specialized trained officers, they're chosen specific, well, they're not chosen, they volunteer for it. And that's the key to it, in my very humble opinion, is because they have a passion for it. You know, either someone in their family suffers from mental illness and so forth, or some type of crisis. So they're really heavily involved in it, and that's why I believe our program is very successful. So just want to, again, put that on the record, let you guys know what we're trying to do here in the city of Cleveland Division.
No, that's wonderful. Even a step in furtherance of the care responding model.
Right.
Recognizing that officers are not meant to be social workers.
Yes, absolutely. Yep.
Is a great opportunity. So great job, Councilman Mayor Bibb. Thank you, Chief, for sharing.
Ms.
And-
Bryan?
And Madam Chair, I just wanted to say, the Adams Board is involved with the co-responder.
absolutely.
Team, and let's.
Yeah, and I don't want to leave them out whatsoever. They're our partners, and if I did, it was not by design. The Adams Board, I'm partnering with them.
Trying to get your credit on
And actually, matter of fact, they train our officers. So they train our officers, and they help us hire the clinicians.
Yeah,
So
no, we're great partners.
absolutely, we're partnering together. So
Yeah.
thank you for mentioning that.
Yes,
Yep.
thank you, Chief.
Well, it's a wonderful city-county partnership.
Yes, it is.
That regional approach we mentioned in the beginning, so. Rosie?
I just wanted to mention something about the schedule. I could be wrong, but I thought that you all were supposed to meet in January of this year, but there was a really bad snowstorm, and so it got postponed to February.
You're a month off. It was supposed to be February this year, and it got postponed to March.
Postponed to March? Okay.
Yeah, so
Sorry.
contingent on another, epic snowstorm here, and we'll have it in
Okay,
February.
I just want to make sure
It's
the
snowing right
timeline
when
was
we
right.
call it.
Thank
Yeah.
you.
Thank you, Rosie. All right, hearing no other new business, the time is now 5:06 p.m. Thank you all for your time. Meeting is adjourned.
Thank you.
Awesome.